Hi guys, this is Dr. Khan from Your Family Doctor, and today I'll be talking about a video which was created by Dr. Mandell for Motivational Doc, talking about when one should be taking their vitamin D. Although I agree with most of the points he mentioned in the video, there is one point which I do not agree about. So let's see this clip.
And vitamin D is probably one of the most important fat-soluble vitamins that our body needs to stay healthy. But I want you to look at vitamin D as your defense. Why? Because vitamin D instructs your white blood cells to manufacture a protein to kill infections. And it's proven that it will lower the percentage of many different types of cancers that can affect your body. And this is what builds your immune system.
So as you can see, Dr. Mandell mentions or states that vitamin D is proven to reduce the percentage of many different types of cancers. This is obviously false. Although I agree that certain studies or some studies were done which showed or suggested that there may be a possible link between taking vitamin D and a reduction in colorectal cancer. Follow-up studies were done, for example, one in females who were taking vitamin D over a period of 7 years. And in this study, it was shown that they didn't have a reduced incidence of colorectal cancer as compared to those women who are not taking vitamin D. Okay, so the following information that I'm about to read is taken from a National Cancer Institute, and I would advise you to read the full paragraph under the section, "What is the evidence that vitamin D can help reduce the risk of cancer in people?" So if you look at the highlighted bit at the bottom, it states, "Evidence on the association between vitamin D and the risks of all other malignancies studied is inconclusive." So as you can see, there's no proven link between taking vitamin D and a reduction in colorectal cancer. And I think it's quite dangerous for a doctor especially to make a statement like this when there isn't enough research to support this link. Okay, so now I'm going to mention to you guys about the factors that are strongly associated with the reduction in cancer and which have a greater scientific backing. And these are, okay, cigarette or tobacco smoking is known to be associated with certain types of cancer such as mouth and lung cancers. Interestingly, passive smoking is also associated with certain types of lung cancer. So reducing smoking, or especially quitting smoking, can help to reduce your risk of getting this. Number 2, eating a healthy diet, especially plenty of fruit or veg, or plant-based foods such as beans and whole grain foods can help to reduce the chances of you getting certain types of cancers. Number 3, being overweight and obese also increases the chance of you getting certain cancers. So avoiding sugary foods and high-calorie foods can help you to reduce the risk of getting this. Number 4, if you choose to drink alcohol, you should drink so in moderation, as increasing levels of alcohol and drinking at regular intervals is known to increase the risk of certain cancers. Number 5, reducing processed meat and red meat in particular is known to reduce the risk of people getting colorectal cancer. Number 6, the other factor in reducing cancer is by keeping physically fit. But for substantial health benefits, you should strive to get at least 150 minutes a week of moderate aerobic activity or 75 minutes a week of vigorous aerobic activity. You can also do a combination of moderate and vigorous activity. And as a general goal, you should include at least 30 minutes of physical activity in your daily routine. And if you can do more, even better. And number 7, you should also protect yourself from sunlight, which can cause certain types of skin cancers, with the malignant melanoma being the worst of these cancers. And number 8, you should make sure that you get regular screening done if you fit the criteria for things like colorectal cancer screening or bowel screening, as well as cervical and breast cancer screening in women. And number 9, if you're worried about anything in particular, such as a lump or bump that has appeared anywhere in your body, or if you've noticed, for example, blood in your urine, you should see your GP or your family doctor straight away. Okay guys, so that's the end of the video, and my message to you guys is that don't always believe in what you read, hear or see on YouTube, and always ask for scientific backing, whether it's a research article or a link that you can refer to confirm the information for yourself. Please leave any comments in the comment section below, and if you're new to this channel, please consider subscribing. If there's anything else you'd like me to talk about, then please leave it in the comment section below. Thank you.